or to do their after-school activities if they're teens. And from that work, they earn privileges. TV, PSP, Wii.
Goes on and on.
Going out with friends.
Right.
I don't use sports as a means of reinforcement because I think that's really important. Usually, when children are having problems in terms of behavior, they need that outlet to get that frustration out. So I would not say you can't go to soccer today. But in terms of going out with your friends and things like that, those are earned. TV time, internet time. You earn it.
I agree
So
with that.
it changes the whole concept. You're not taking away anything. You are giving. The child is earning. That makes them feel good. And talking about self-esteem, that builds their self-esteem.
You know, I'm so glad that this is being televised, being taped, because otherwise I'd be sitting here taking notes. And now I can just watch it again. And I'm sure that my viewer, are you getting a lot out of this? Because I am. I think she's terrific. What about children acting out the behavior of parents? What does that mean?
Children, our most important figures in our life, our biggest teachers are our parents. And what we do is we watch their behavior, we take it in, and we act it out. Very simple. So we identify with it. And we do like mommy or daddy did.
You know, Paul Simon wrote a song, and I say this a lot, and it's very apropos here. Paul Simon wrote a song called Still Crazy After All These Years. You remember that? And there was one line in it that I never forgot. And he writes, I seem to lean on old familiar ways. And what you're telling me is that the parent's behavior becomes familiar to the child, sees it over and over and over again, and starts to act out the behavior of the parent. Am I on target?
Absolutely on target, and I can just get a little specific.
Go ahead.
For example, I work with couples, and they come into my office because they're having marital conflict.
Right.
And what do we find out? That maybe the man will just say came from a family where his mom was very submissive and his dad was very authoritative. And maybe his wife came from a family where the mother was very strong and the mother was submissive.
Wow.
Okay? So
collision.
A match made in, I don't know, heaven, hell, I don't know.
Made in heck. Okay.
Made in conflict,
Right,
okay?
Right.
And what happens is, what are they doing? They're really fighting the battles of their parents, of their childhood, with each other. And what I do is, maybe in a moment I'll be showing you a genogram, and I actually can show my clients.
Do you want me to take it out?
Yeah, we could do that.
Okay, we have this poster here. I'm going to hold it up, and then we can see which camera can get in there. And you can use a pen, or you can use a pen if you want to point. And let me wait till we get this on. Can you zoom in? Great. Okay, fine. Okay, now go to it.
I'll just show you. This is the couple that comes in, and you see all these squiggly lines. That's conflict. And look at the woman. She's in conflict with her mother. The mom and dad are in conflict with each other. The man here, there are no lines. How come? Everybody was so avoiding each other, distancing from each other.
Oh, that's interesting.
These two get married, and what happens? There's just such conflict because she wants to do this with him, and what does he want to do? He wants to run away. So there's the patterns. And then if we can just look, this particular couple, this other couple that I'm talking about, they had, the man had gambling and alcohol issues. And if you look, we learn this. It's in our family. It goes back to generations. His dad was a gambler. His grandfather was an alcoholic and a womanizer.
What a great family you're portraying here.
Well, I'm just showing you how people learn. And on this side, this woman's fighting is part of her anxiety. And there was so much anxiety and depression in the previous generations. You know, one of my goals as a psychologist has been to bring psychology to everyone in their homes. And this is just a wonderful opportunity for me to be able to share this, because I do this with graduate students and with fellow professionals, to show people, if people can realize what they're doing is normal considering where they came from, then they have the choice to change it.
That makes great sense, and that's so important. And why is it that people are so, I mean, I have my own theories.
Yes.
But why is it that people are so afraid to change when you present to them, after going through all this, you don't have to do this anymore?
Well, we're habituated.
Paul Simon's line.
That's it.
I seem to lean on old familiar ways. The woman, the daughter who was abused, marries an abuser.
Right, right. You know, they say the devil you know is better than...
The devil you don't.
Exactly.
Oh.
And that fear. So you stay stuck, and we keep repeating the same patterns over and over. And that's where the role of a therapist comes in, to help the person work through that and change that.
Right. It's a tall order, and
Well,
it's not easy to do.
And that comes with transference, which I know we'll be talking about maybe in a little bit.
Well, let me ask you this. What about, you know, we discussed there's a boundary guard.
Right.
Okay? And how does that work in psychology?
Oh, excellent. When a family comes to your office, or a couple, the psychologist has to get permission from the boundary guard, and the boundary guard is the person who has the power in the family.
And who does that be?
It could be the wife, it could be the husband. Sometimes when they come in with teens, it could be the teen. I've had cases where they come in and the teen says to me with his parents right there, will say, he or she will say, I don't want to come to this office with my parents. I don't want to be here. I don't want you to change my family. I want it to stay the way it is. So what I have to do in that case is I ask the child or the teen to leave, and I work with the parents and I strengthen them. They need to get the power.
Well, then that takes me to the next thing, because what I'm hearing is that the parents have to have a very healthy relationship.
Absolutely. They have to have at least be on the same page, and the healthier the relationship the parents have, the better it is, because they give one message. If parents give more than one message on the same thing, then what does the child do? They learn to manipulate.
So it takes me then to the